Hi there, we're going to go over the basics of the nerve trainer. As you can tell, there are 4 vessels, symmetric on both sides. 2 of the vessels can be filled with a nerve, which is essentially a hyperdense tube to enable fluid to be injected between the nerve and the channel itself, so the fluid doesn't destroy the phantom but rather expands beyond it. There are 2 ways to use the phantom. I'll take you through the easy one first. Easiest way to use the phantom is to get both nerves wet and slide them into their respective slots. A little bit of rotational jiggling can help get them in easier. As you can tell, they're relatively snug, and what that does is it gives them a small gap between the vessel itself and the nerve material. So when you place an injection in between the 2 objects, they can expand and fill and then exit out the sides as opposed to damaging the material. Easiest way to use it is to put the whole device into a container of water, rocking it back and forth and squeezing out any air bubbles in the trainer. What that will do is give you a nice, easy way to access a view of both the nerve and the vessel in pairs. As you can tell, the nerve has a much more hyperechoic visualization, and if you relax your probe, you can actually start to see the little bit of barrier between the 2 objects. If you ever want to have your nerve modified to be more obvious, less obvious, or different appearance, let me know. We can customize the inserts for you. And every trainer will be slightly different. So when you want to find your best viewpoint or target to see what the nerve will look like, it helps to adjust through relative gain to find a good visualization and a frequency that works best for you that makes the nerve look most realistic. When you're done with your trainer, simply take it out, tap out all the water. You can leave the nerves in place if you like, or you can use a device or your finger simply to remove each of the nerves and store them out at room temperature. I'm going to leave one nerve in to show you how you can use different stoppers. So for our classic blood vessels, you just use a Luer lock fitting, inject fluid into the container to fill it up. And go to the top until you start to see fluid escape, and then insert the other fitting, making sure to get all the air out of the chamber. For the other types of fittings where the nerve needs to have some fluid around it, but you do want it to drain out, you can use these L brackets. An L bracket fitted in place will allow you to actually add fluid to the container. And it will fill up into the chamber. And then once the container is full of fluid and you've gotten all the air out of the system, now when you inject, excess fluid will be able to escape out the ports. Just leave a mat or something down to catch the extra volume, but that way you won't generate any excess pressure when you create a sheath that you're injecting into. So you get the same appearance of a nerve, but now when I inject into that sheath, it will simply exit out the chamber. Gas, air, whatever you put into the space. That's it. Okay. All right, and here will be an example of a blood vessel and a nerve. Here I have the Luer fitting and a simple L channel. If you ever want to add more back pressure and make the fluid injection more obvious, you can add a little bit of resistance or tubing or reach out for a different modification in order to create a more obvious sheath as you inject into the target space. I'm injecting right now and getting resistance, and as I reach to the actual target and the potential space within, I get a sudden amount of give. I can see fluid flowing around the nerve sheath. And after delivery of the injection, I can just see the fluid has come out the exit channels. And when I'm done, as before, I can just drain out the extra fluid and allow the Phantom to dry at room temperature. Make sure not to leave large fittings in the device for a long period of time, or to insert fittings well beyond their intended distance. What will happen is you'll create fraying between the two vessels. So after use, always take all the material out and allow it to dry at room temperature.